Welcome to Health Professional Radio. I'm your host, Neil Howard. Our guest is returning guest, Dr. Edward Soffen. He's from ProCure Proton Therapy, and he's joining us on the program as a returning guest to talk about proton therapy for breast cancer and talk about the benefits of proton therapy versus traditional radiation therapy. Welcome back to the program, Edward. How have you been?
Very well, thanks. And Neil, thanks for having me back. It's particularly relevant because Breast Cancer Awareness Month is coming up in just 2 days, and I think it's great to get the word out to raise people's awareness, not only about screening and diagnosis, but what their treatment options would be.
Now, normally, I guess one of the most common treatment options is radiation therapy. Is that correct?
Yes. A number of years ago, multiple studies were done that showed that women who have small tumors, solitary breast cancers, can undergo breast preservation by having a lumpectomy and then having their breast and sometimes the lymph nodes treated as well. And that has the same cure rate, the same recurrence rate as a mastectomy. So now radiation plays very highly into women who have both early and more advanced stage breast cancer.
Well, when it comes to some of the options, let's talk a bit about proton therapy. Now, you're from ProCure Proton Therapy. For our listeners who may not be familiar from the last time you were here with us, give us a bit of background about ProCure Proton Therapy.
Right. Well, a proton or proton therapy is a type of radiation, unlike conventional X-rays, which go into the tissue and go through it and out the other side like any kind of X-ray. A proton is a highly energetic particle, and we can create beams of these particles that travel at almost the speed of light, and they stop. They can be focused and targeted right into the tumor, or in the case of breast cancer, right into the breast, or right into the lumpectomy cavity. And what's fascinating about protons is that they stop. So when they come to a stop in the target, they give off all of their energy and destroy the tumor cell. So it's different from conventional radiation because it doesn't irradiate as much of the normal tissue around the target. Like particularly in breast cancer, it spares lung and it spares heart and it can spare the nerves under the arm.
What do you think about a person that's decided to do the radiation thing and then becomes aware of proton therapy? I'm not familiar with how radiation, the regimen operates, or the frequency. I guess it's determined by the severity, I guess, of the disease. I guess that makes sense.
Right.
But why do you think it's important that women be aware of proton therapy, even if they've leaned toward radiation?
Right. Well, it is a form of radiation, but it's important to know about protons. There are fewer than 30 facilities in the country, so not every woman knows and has access to physicians who are aware of protons. But protons can treat almost every woman with breast cancer to varying degrees of importance over conventional radiation. But, once a woman is diagnosed and is staged, she really needs to meet with a group of physicians who understand about all the treatment options and can determine whether protons really will have a benefit to them over conventional radiation. You have to understand protons and have experience with it to really understand the benefits, and that's why I think it's great that we can get this information out on the airwaves.
Is there a patient who's not a good candidate for proton therapy, or is this something that can benefit anyone with this type of cancer? Right.
That's a great question. Well, I would say most women can be treated with proton. Now, some women will have more benefit over others. Now, when I talk about benefit, the cure rate is the same as conventional radiation when it comes to breast cancer. But what we're really trying to do is minimize the side effects and the long-term toxicity. So women, for example, who have left-sided breast cancer as opposed to breast cancer on the right side will benefit a little bit more from protons because the heart is on the left side and can be spared much more than conventional radiation. Women who have lymph node positive disease, stage 2 or stage 3, will also benefit more from protons because the radiation treats not only the breast, but the lymph nodes under the arm and under the clavicle. So in those women who have lymph node positive or even left-sided breast cancer, there's even more of a benefit to protons. And the last candidate that I want to mention are women who have previously had radiation to the breast or to the chest wall if they've had a mastectomy, and now in that unusual event have a recurrence either in the breast or on the chest wall. They really can't get conventional radiation again. I've had a number of women who we treated 15, 20 years ago with conventional radiation. They recur in their breast, and then we can sometimes offer protons in lieu of or to replace a mastectomy. So women who have had radiation can then sometimes get protons to salvage a recurrence without having to lose their breast.
Being able to reduce the radiation to the heart and the lungs and other unaffected areas, what about some of the long-term side effects that aren't present with proton therapy as with traditional radiation treatment?
Right. Well, so yeah, that's the big thing. We want to cure women, but we want them to be alive and well 5, 10, 15, 20 years from when we treat them. We don't want them to experience heart disease or lung disease as a result of their treatment. You know, we don't want the cure to be worse than the disease. Now, when it comes to treating breast cancer, the lung is right under the breast and the heart is right under the left breast. And we have shown in multiple studies, and the data continues to emerge and is growing rapidly, that protons offers a significantly lower dose to these critical structures. And that translates into less heart disease, lower incidence of myocardial infarction or heart attack, and a lower incidence of lung scarring. Also, in women who have a prosthesis or a tissue expander, the pencil beam scanning, which is a type of proton beam irradiation where we paint little points of protons that can curve and carve around critical structures, we can treat women who have tissue expanders or implants with much less scar tissue and fibrosis because we can literally dance the protons around the expanders without having to treat them.
Would you say that's part of the overall patient experience there at ProCure?
Well, the patient experience starts from the minute they walk in the door. We have a concierge service. We have a team of nurses and therapists who really care about the patient. We have a physics team, dosimetry, and physicians who are highly skilled and trained in protons. But you know what? The whole experience is one of caring, empathy, communication. So not only are patients treated with the most sophisticated type of radiation, but it's a warm, caring environment that I think patients, really appreciate. On Wednesdays, we have a graduation ceremony for patients who finished their treatments that week. And we have people coming back who have been treated 5, 6, 7 years ago, who continue to come back for graduation to tell their story, to embrace and encourage those who are starting their journey, who are finishing their journey. And it really becomes almost like a club of people, survivors who have been cured with protons.
Where can we get more information about ProCure and get in contact with you as well?
Right. Well, you can look up ProCure on the internet or go to procure.newjersey.com and get our phone number, give us a call. And our intake people, our intake nurses, will get you in with a physician probably within 24 or 48 hours.
Dr. Soffen, thank you so much for coming back and speaking with us today. It's been a pleasure as always, and let's do it again as soon as we can.
Absolutely. Thanks so much for the invite, Neil, and take care.
You as well. You've been listening to Health Professional Radio. I'm Neil Howard, your host, in conversation with Dr. Edward Soffen, returning guest from ProCure Proton Therapy Center in Somerset, New Jersey. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.